Good afternoon. My name is Tutor Nakusi Beth, and this afternoon I'm going to talk about how best we can take vital observations. Vital observations are routinely done by all nurses and they help us to detect the functionality of vital organs. That's the heart, the brain, the kidneys, how they are doing. So this guides us in performing our nursing care rationally. And the equipments that we normally use, we have a pulse oximeter. This helps us to tell the oxygen saturation of our patient and the pulse. We also have the stethoscope. It helps us to know how the heart is beating. And we regularly use it when we are taking the blood pressure and even when we are checking how the patient is breathing with ease. We have a thermometer. This tells us the temperature of the patient. Thermometers are in two. We have digital and mercury. And the one I have right now here is the mercury thermometer. And then we have a blood pressure machine. We have the digital one, and then we have the one which is the mercury one. In most cases, current practice, we are measuring on using the digital ones. But if the mercury BP machine, blood pressure machine is available, it is the preferred because it brings us to a point of understanding nicely how the systolic blood pressure is and how the diastolic is. So I am going to get on our patient in the ward, and the measure I'm going to take this patient is blood pressure. Komugisha, good afternoon.
Good afternoon.
How are you? Yeah, you will be fine. This afternoon, I'm your nurse, and my name is Beth Nakusi. I'm going to majorly see how your blood is circulating so that we see whether there is another drug to add on what you are taking or we maintain the dose you are taking. Is that okay? All right, so I request you to sit up. It is best taken when you are sitting up, just like your legs get in front and you sit like that. So I'm going to use this right hand of yours. Just extend a bit nearer. So this cloth, I'm lifting it up so that we get the branchial artery exposed and we get where we will have our cuff fixed. For my patient, he has been on antihypertensives. I'm preferring to use a mercury thermometer. And this is my mercury blood pressure machine. I first want to see that it's functioning well before I get it on the patient. Yeah, it is in a good functioning state. So the next thing, I'm extending it to where she is. I just have it at this point, and this is the right cuff. So I pick my stethoscope. I hold it to ensure that the pads are well directed into my eardrum. And here we are going to use the bell. I have it positioned onto the branchial artery. What I'm going to do, I'm going to inflate until I hear the first sound. So So the inflation, when I inflate it, it helps me to detect the two sounds. The first sound, which I first heard, is the upper sound, which is at the upper limit. It tells us the systolic blood pressure. And the second pulse, the second one is the diastolic, and we record it as systolic over the diastolic. For my patient, her systolic blood pressure is 110 and the systolic blood pressure is 82. This tells me that her medicines are working because it is well controlled. After I have noted the blood pressure, the next thing is I get the cuff of her hand. This makes a patient a bit uncomfortable, so after getting the results, I get it off and make her feel comfortable. Sister Komgisha, your blood pressure is 110 out of 87, and currently you continue with the drugs you are on. We will check on you again after 4 hours from now, and that will be at 6 p.m. The next thing, I get onto the temperature chart, the vital observation chart, and I have this charted for record purposes so that the next nurse will pick it up from here. Sister, thank you. You can get back in bed.
Thank you so much.
And you lie down. We will come to you again at 6 p.m. to have another blood pressure checked. Komugisha, good afternoon.
Good afternoon to you, sister.
Is it a good afternoon or it's an evening?
So good evening.
Okay, I was trying to see whether you are oriented to time. How are you feeling this afternoon, this evening?
Better.
You're feeling better? Have you taken your drugs?
Yes.
Okay, like I was telling you at around 2 when I took your blood pressure, I have come again to see how you are doing. Yeah, it will help us to check on maybe add something or reduce some other thing. So I'm just going to have your blood checked. So you can just remain in this very position, just extend a bit here. You'll have this cloth up. This time I'm going to use this machine, this blood pressure machine, which is digital. It will just read for us how your blood is, how your heart is contracting and relaxing, so that we really know. Lift the hand a bit. So with the digital blood pressure machine, we do not need to use a stethoscope because for it, it detects it. It just detects it. It will just write for us the systolic and the diastolic, and we record it. What we do is we switch it on, then it starts working. Okay. Her blood pressure is 115 out of 69. The digital machine has read the blood pressure, the systolic, that is when your heart is contracting, as 115, and the diastolic as 69. This means that your drugs are actually working well. Your blood pressure is controlled. So what they will do is probably to reduce the dose of the drug you are on so that it shouldn't go below that. But as per now, that is how it is. We will come again at 10 p.m.
Okay.
Yeah, and we will come with the physician to review and make adjustments according to what we are recording.
Okay.
Thank you so much. Yeah, you can get back to lie. So after noting that, it's very important for us to have this charted, because at 2 p.m. we had it, and at this time we are recording it as 115 over 69. This means there is a good difference in the control of it. So we'll pick it again at 10 p.m. and we monitor the trend. Thank you.